Hi, my name is Jacqueline Borden. I am a Purdue Global University student, and I would like to present a slide deck to you, which will discuss a program on culturally competent nursing for registered nurses working with Asian patients, an explanation of class standards for healthcare, and how class standards can be incorporated in a nursing curriculum. So I'm going to share my slide deck with you. Presentation, okay. So the program presentation, virtual clinic assignments. The PowerPoint program will discuss a program on culturally competent nursing care for registered nurses practicing in acute care settings with a focus on Asian culture, an explanation of what class standards mean for healthcare and how class standards can be incorporated into the nursing curriculum. Okay, so the nursing program for culturally competent nursing care of Asian patients. The Asian American population in the U.S. is comprised of people having origins in East Asia, Southeast Asia, or the Indian subcontinent. According to a 2015 Census Bureau population estimate, there's 17.3 million Asian Americans living in the United States. They account for 5.4% of the nation's population and have mainly a bi-coastal distribution. It's one of the fastest growing minority groups. As immigrants, Asian Americans, as any other group, experience emotional and behavioral problems. They tend to underuse services unless they are culturally and linguistically compatible for them. So there's many cultural factors that can impact the access and effectiveness of mental health services provided to Asian Americans. These factors, with psychiatrists should be aware of, may include language barriers, stigma or discrimination against mental illness or people with mental illnesses, cultural reliance or traditional Eastern-based practices to treat mental illness, such as herbal medicines and spiritual healing, cultural practices of involved decision-making by the family and the community regarding healthcare decisions, lack of accessibility to mental health care facilities that are affirming to Asian American populations, fear of being deported due to illegal immigrant status, providers' misunderstanding of culturally sanctioned expressions of distress among the Asian American patients, providers' knowledge of appropriately prescribing psychopharmacotherapies to Asian American patients. And an example of this would be they have a slower metabolism of drugs by some Asian Americans, which indicates a need for lower doses. Okay. So nursing program based on Asian patients and cultural beliefs. So the setup of the program that I'm looking at, the nursing self-assessment of how one views their own culture and the cultural differences of others. The class assessment, understanding cultural differences within the classroom for diverse student populations. Skills and techniques for providing feedback and measuring comprehension with regards to the student cultural beliefs and behaviors, and assess nursing knowledge and understanding of the Asian cultural and beliefs for medical care and treatment. So, best practices to consider: assessment of the language barriers, ascertain whether the patient speaks English or not, their native dialect, and the degree of acculturation, allowing sufficient time for interviews, be patient with them, promotion of educational resources for mental health, for any kind of disease process, increase the patient's and or community's awareness of mental health and disease processes for prevention of disease, inquiries about the traditional beliefs of the Asian population, ask about traditional beliefs to gather information of how these beliefs can influence an individual's expression of any kind of distress they're having, or the preferred methods for treating any kind of health disorders. Incorporate traditional interventions when appropriate culturally and individually. Consider traditional practices. The supplemental treatments they have includes diet, exercise, other traditional methods that they use to reduce stress and increase relaxation, such as yoga, tai chi, breathing exercises, etc. Utilization of cognitive behavioral therapy for them. Consider prescribing cognitive behavioral therapy where appropriate. Becoming familiar with any kind of medications that they usually use in the home, like herbal medications, and other kind of behavioral practices for healing. So you want to educate nurses to ask questions in regard to race, prejudice, beliefs, and stereotyping, record programs and share PowerPoint presentations, encourage self-learning on the Asian culture through journals, focused on evidence-based practice learning and nursing, and offer evaluation of programs and processes, support, and mentoring to encourage suggestions for optimal learning. Asian culture, healthcare beliefs, and behaviors. So in this culture, health is balanced between yin and yang. So they believe that yin is the hot, yang is the cold. If a person's energy, which is their qi, is off, the patient may feel ill or be ill. The body is sacred to them, so it's viewed as a gift. The healthcare behaviors to stabilize yin and yang consist of the use of acupuncture. Fofo is a massage by women healers, acupressure, herbal remedies, folk healers, and moxibustion. There's a belief in reincarnation, and surgical procedures may be refused due to the belief the body is required to stay intact. And then their dietary behaviors. Lactose intolerance is common among the Asians. Use of spices are common and may affect sodium levels, and diet is utilized in treating illness, which consists of rice, meat, seafood, and vegetables. So completion of a formative and summative assessment are a key for success. So the program evaluation and nursing feedback can aid in information retention for the nurses for this program. So the next part of this slide deck I want to talk about is what is class and how is it utilized to improve quality of care to healthcare patients, which is class stands for culturally and linguistically appropriate services. So for us, culturally and linguistically appropriate services is a way to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities, achieve health equity. So the class is about respect and responsiveness. Respect the whole individual, respond to the individual's health needs and preferences. So health inequalities in our nation are well documented. Providing class is one strategy to help eliminate health inequities. By tailoring services to an individual's culture and their language preferences, health professionals can help bring about a positive health outcome for diverse populations. And I'm just speaking of the Asian population, but there are all kinds of cultures that a nurse has to be aware of, and their behaviors and their beliefs. So the provision of health services are respectful of and responsive to the health beliefs, practices, and needs of diverse patients, which can help close the gap in health outcomes. The pursuit of health equity must remain at the forefront of the efforts of class and of any healthcare entity, and they must always remember that dignity and quality of care are rights of all and not the privilege of a few. So here it says, what is class? Services focused on health behaviors, respect and cultural beliefs, health literacy, required ways for communicating with each other, primary language choice. What are the standards of class? Language and communication assistance, governance, leadership, and workforce, engagement, continuous improvement, and accountability. So what class standards mean for healthcare? A way to advance health equity, improve quality, and help eliminate disparities. Class standards are utilized in the healthcare setting through the implementation and utilization of language assistance services and interpreters, incorporate culture into the healthcare mission, implement a community representative to help with any kind of diversity and disparities, and conduct organizational cultural assessments. The most important thing is to implement educational material that is conducive to the culture, their behaviors, and their beliefs. Make sure that it's in the language that they speak so that they can understand the education that you're giving to them better, or understand the healthcare better. And this will help with better outcomes. So there's principal standards: provide effective, equitable, understandable, and respectful quality of care to the patients; governance and leadership and workforce; advance and sustained organizational governance and leadership that promotes class and health equity through policy practices; educate and train governance, leadership, and workforce in culturally and linguistically appropriate policies and practices; communication and language assistance; and then the engagement of continuous improvement and accountability, which is establish culturally and linguistically appropriate goals, policies, and management accountability, and infuse them throughout the organization's planning and the operations. So, use of class in healthcare helps with communicating pertinent healthcare information to the patient, education and disease process management, diversifying treatment options based on cultural beliefs and behaviors, educating healthcare providers on recognizing the cultural differences and how to provide optimal healthcare to diverse patient populations. So, language assistance services and interpreters incorporate culture and the healthcare mission. Implement a community representative that we talked about, conduct organizational cultural assessments, and implement educational material on culture for the healthcare staff so that they understand the different beliefs and behaviors of other cultures. So how class standards can be incorporated in a nursing curriculum for daily patient care. Incorporate class standard essentials and e-learning orientation programs. I think this is very important for all nurses and for all healthcare providers. Utilize self-awareness tools. Utilize interpreters and language lines for communicating. And incorporate guest speakers, group training programs, and community partnerships. I really like this slide. It's just a simple gesture. You want to show respect, empathy, and relationship building. This helps with all of those. So class is about respect and responsiveness. Respect the whole individual and respond to the individual's health needs and preferences. The provision of health services that are respectful of the responsiveness to the health beliefs, practices, and needs of diverse patients can help close the gap in the health outcomes. So incorporating each standard for nursing. Introduce leadership to nursing students at the beginning of the nursing program. This is really important. Communicating is important to ensure safety, engagement improvement, and accountability. Advances in health equity, improvement of quality, and eliminating disparities. Here's the references that I was talking about. So be engaged. Engagement is the most essential activity for progress. Consider the consequences of discriminatory practices and policies. Understand the impact of policies for the underserved populations. Use a data-driven approach from implementing evidence-informed practices to measuring outcomes. Be aware of systemic barriers. Understand how barriers can affect healthcare outcomes. Understand the role of healthcare education and the needs of different cultures, how they need to be educated. Make sure that you're talking to them in layman's terms in their own language so that they can understand and they can have better outcomes in the future. Thank you very much for listening, and I hope you did learn something from my slide deck.